Hello, everyone, and welcome back to Atlantic Coast Aesthetics. I'm Matt with ACA, and joining us once again is Dr. Thomas Pane, Chief Medical Officer and founder of Atlantic Coast Aesthetics. And Dr. Pane, we have a question here. It's a question from Boca Raton. It's about breast implant removal, and the person's asking, why do some plastic surgeons remove the capsule and others not? Which procedure is more common? What are the risks of not having a capsulectomy? And it looks like their implants are 15 years old and saline, and one is ruptured. And also they're asking, can you develop mold in a saline implant? If so, is removing the capsule a must? Dr. Pane, what do you recommend in this situation?
That's a wonderful question. It covers a lot of different topics, probably more than we can get into here. But the basics are, we're talking mostly about cosmetic surgery. In reconstructive surgery, you might get slightly different answers. There's been a lot of work that's gone into why scar capsules form around implants. We still don't fully understand it, or what causes it, or how, with the risk factors of cutting down the recurrence rate. An implant like this here is a silicone implant. Your body, when it's a foreign body, forms a little capsule around no matter what it is. That normally is a very thin, filmy tissue. And when the implants are being exchanged later, most surgeons are going, in cosmetic surgery, are going to release that capsule, make some cuts in it to let it expand. So when you put a new implant in, it will not restrict that implant or distort the shape of the breast. Sometimes the capsule can be removed if it gets very hard, thick, or what they call eggshell style, because we get a little worried about putting a new implant in there with a hard capsule, calcified capsule. This may be technique dependent, because in my own cases, I very, very rarely see somebody get any kind of hard capsule. Almost never happens. Most of the ones I see are people that have come in if the implants have been present for a long period of time or done somewhere else, or whatever. There are some techniques, surgical techniques, that may cut down on the risk of that development. But in general, you want to do as little as possible with that capsule if you can. So usually I recommend releasing it. I will remove parts of it, or sometimes all of it, if I feel it's needed. But there can be problems from taking a capsule out that you don't want to get into. So in general, you want to do the simplest, least amount of work on the capsule that you can. An implant that's been present for 15 years usually should be replaced with a new one, because it's been there a long time, and you should get a fresh implant if you're going to be having surgery for that. In terms of chronic infections or mold in the saline, very rare. Some people believe that there are low-grade infections that could be seen, and that might be the cause of the capsule. It's not exactly clear, but what I usually will do is wash the breast pocket out thoroughly with antibiotics whenever I'm doing any kind of exchange procedure, and I think almost all surgeons do that as well. So again, wonderful question. A lot of different directions to go in. We've touched on most of the basics here, and I hope that helps.
Thank you, Dr. Pane. And if you have a question for the doctor, please visit our Facebook page or website. And Dr. Pane, we appreciate your time, and we'll see you on the next question.
Great.